Dr. Shelley Batra. I'm the president and co-founder of Operation Asha. I'm also a Schwab social entrepreneur, selected by the Schwab Foundation. I am so proud and honored to be part of Catalyst 2030 because this is a movement that will genuinely catalyze change and will be able to achieve the SDGs. Our mission and vision is tuberculosis treatment, and I'll come to that later. First, I want my co-host Radhika to introduce herself.
Hi, this is Dr. Radhika Batra. I'm the founder and president of Every Infant Matters, an NGO working in India and Africa for the upliftment of disadvantaged children. So I'm a Forbes 30 Under 30 fellow, trust conference change maker with the Thomson Reuters Foundation. And I'm also a One Young World ambassador. And I'm really honored to be here today with the lovely people at Catalyst 2030 and this absolutely driven cohort who's trying to catalyze change in the world. And I think Dr. Shelley would like to start with her presentation on Operation Asha first. So back to her. Yeah, thank you for having me here.
Right. So let me start with our work, why we chose tuberculosis and as our mission, and why we decided to work in this space. And let me just show some slides. So I hope everyone can see the slides. In 2005, I decided to do something for the poorest of the poor in the health space. And I found that the biggest need is in tuberculosis, which is the biggest infectious disease killer in the world. And TB was the biggest health crisis in India, and of course, the entire world. The sad thing was that tuberculosis is fully curable, but the disease has become a global pandemic. Another thing in the history of TB is that in the past 2 centuries, 1 billion people died of TB, and less than half the number died of all other pandemics combined: AIDS, smallpox, Spanish flu, and cholera, and so on. India has more than 1/4 the world's burden, and that is due to poverty, malnutrition, overcrowding, comorbidities like diabetes, mental health. The disease is highly contagious. Immigration and global travel have all contributed to the magnitude of the problem, and so have inaccessible public health programs and the lack of an effective vaccine. Patients face many challenges. Treatment takes 6 months. They live in absolute poverty. They have to choose between rages or TB medication. There is poor connectivity, no jobs. Where is the bus fare coming from? There are quacks, informal providers, giving all kinds of irregular treatment. Now, the good thing is that our Prime Minister, Mr. Modi, is totally focused on eliminating tuberculosis. And the government is our biggest enabler. There is a huge network of free hospitals, diagnostics, free treatment, free medicines, everything there. And the other enabler is the local communities we work with. We hire and train local people as the DOT providers. They are ordinary people, but they are doing extraordinary work. In urban slums, we have a doorstep delivery model. We open treatment centers in community partners' premises, and that person could be a chemist, a priest, a shopkeeper. In villages where patients are scattered, health workers go on foot, bikes, or motorcycles. And in the Mekong Delta of Cambodia, health workers are going on boats from island to island. We use technology for accuracy and best results. We use a screening questionnaire called e-detection. We use animation videos. We use biometric fingerprinting, e-compliance. And all that enables us to have high quality. As you can see, this is the fingerprinting application that was developed as part of a collaboration with Microsoft Research. And fingerprint is taken even at the center. If a patient misses a dose, the health worker will go to the patient's house, give the medicine, find out what went wrong. You don't have food, your husband is beating you, what's the matter? Solve the problem and take fingerprint as proof of visit. We were funded by Qualcomm Wireless Reach to develop the eCounselling videos. Videos. Hello? Yes, is there a question?
Hi Shelly, I'm Manisha here.
Hi, Manisha. Good morning. So good to meet you. I'm so happy you could join. So I was talking about the
Yeah.
Qualcomm Wireless Reach collaboration, where we develop these animation videos for patients and families, and they give every kind of information that is needed. They dispel stigma, dispel myths, they provide support, and most importantly, they prevent discrimination. You know, we get patients who've been coughing blood for years. They are in self imposed isolation. They live in fear. They are going to denial. And this is how we help these patients. There's a Government of India report that 100,000 women are thrown out of homes every year because of TB. We are turning the tap off on discrimination and human rights violations. Our children are able to get health and go to school. We give love and compassion. We started with India in December 2010. We started work in Cambodia. We are doing 20% of the country's work. In Afghanistan and in Zambia, in the Dominican Republic, our work has been replicated either by us or by third parties. And we are very, very happy with our success. Well, we've got awards and so on, that doesn't matter. Ultimately, it's work and results that matter. And now I want to talk a little bit about our work in the COVID space. And does anyone have any questions so far or any comments so far? So what happened when the COVID crisis started? Now, there was a very big need suddenly in the country. The country's in lockdown. People are frightened. They have no food. They have no one to care for them. And our health workers can no longer go door to door to meet up with the patients. So our first project in the COVID relief was to utilize the network of community health workers and the trust they have built in the communities, disadvantaged communities themselves, to deliver key messages of, given by the government of India. Now the government is very focused, and their messages of sanitization, social distancing, what are the signs when you must go to the hospital, and sometimes guidelines change. Initially, there were no masks. Now you're supposed to have masks. So over 2.5 million people in 4 states of India, we have health workers who are disseminating education and awareness programs on COVID-19. Another thing we have done is we have found that there are a lot of mental health issues. People are frightened, they are stressed out, there's anxiety, and people who had existing mental health problems, their condition is worsening. So we have promoted a mental health helpline amongst all the beneficiaries that we serve. This helpline was started by a group of psychiatrists, psychologists, and volunteers who are based out of New Delhi. The helpline is working 9 a.m. to 9 p.m. And we've also popularized this to take care of questions related to COVID with a focus on mental health issues, even in Africa, in Nigeria, and Kenya. Another thing we've done is to do direct distribution. Patients have no food. We've got grocery bags. We've got money that we are giving to people to pay their rent, to pay their phone bills, to buy food for themselves. And we have given up to 69,000 rupees to 80 families who are really the poorest of the poor. And they would have left Delhi, left the TB program and gone back to their villages. So we've retained them within the TB project by doing COVID relief at the same time. With this, I hand over to my colleague Radhika, my friend Radhika, who will talk about Every Infant Matters, their core work, and their work in COVID relief. Over to Radhika.
Hi, good evening, everybody. My name is Dr. Radhika Batra, as I introduced myself earlier, and I'm a pediatrician working with the Government of India. I'm also the founder and president of Every Infant Matters, that is an organization serving disadvantaged children in India and Africa. And I'll tell you a bit about how I started with this work. I had just started my residency in pediatrics, and every day children used to die on our residency rounds and on our duties, children used to die. And a lot of them used to become disabled or blind. And this really hurt me somewhere because the numbers were a lot. And what even hurt me more than that was that almost 60 to 70% of these deaths or these irreversible disabilities we could have prevented with a simple, timely, cost-effective intervention. And that's when I started off with Every Infant Matters 3 years ago. So we've come a long way since then, and I'd like to share some slides and talk about Every Infant Matters and our work. Just a second, I'm just having a little trouble loading the slides. So I apologize for the technical glitch. Just 1 second.
I think it'll open in a moment. Radhika, why don't you tell about the blind child you saw in the OPD?
Hi, I hope everybody can see the slides now. Are they visible?
Not yet.
Are they?
Not yet. No.
Not yet? Okay, just a second.
Have you shared the screen? I think you go to screen share. I think you tell about the work till we find the slides.
Yeah, I hope everybody can see the slides now.
Yes, that's right.
So we're focused on SDG 2 and 3. And as we all know, 1 million hungry children become blind every year because of vitamin A deficiency. But hunger is not just about feeling hungry. Hunger leads to devastating consequences like stunting, recurrent infections, rickets, anemia, other deficiency diseases, and blindness because of vitamin A deficiency, poor school performance, low IQ, and other cognitive and behavioral problems. So hunger and disease have a cause-effect relationship. 20 million newborns are born with low birth weight because the mothers are malnourished and they don't get adequate nutrition in their pregnancies. They don't get adequate rest. They have to work through the pregnancy. So that's why that leads to intrauterine growth retardation and 20 million newborns being born with a low birth weight. 880 million children in the world suffer from worm infestations of all kinds of helminths, which causes stunted growth and abdominal cramps and all sorts of serious sequelae. 250 million children suffer from vitamin A deficiency and are at risk for irreversible blindness, out of which 1 million children ultimately succumb to this problem and become irreversibly blind because of vitamin A deficiency. Now, vitamin A deficiency occurs in these children because they don't have nutritious food to eat. They survive on meager amounts of low quality foods like small amounts of rice. There's no milk, no butter, eggs or cheese in their diet, no green vegetables. They have a loss of nutrients because of worm infestations. They get recurrent infections, recurrent diarrhea, which further causes loss of nutrients and leads to vitamin A deficiency. Now, at Every Infant Matters, we are leveraging the power of partnerships. We have a partnership with an American NGO called Vitamin Angels, which is a US-based 501c3 nonprofit, who is giving us free vitamin A and free albendazole for distribution, and they work in 70 countries, and 3 of those countries are with us. And Every Infant Matters has implementing partners in India, including the Indian Medical Association, religious groups like the Gurudwara charitable clinics, Center of Development Initiatives in Assam, that is a church group, then hospitals, doctors, nurses, local grassroots NGOs like Chetna and Saksham Foundation, Robin Hood Army, Donate a Meal, etc. And in Nigeria, we have an implementing partner called Jexiume Foundation. We've recently expanded outreach to Kenya, where we are working with an organization called Jihusishu Foundation. Now, this is how partnerships have helped us. We've got free medications worth $500,000. We've utilized and established last miles in 3 countries. We are working on minimum cost. We have a low cost, high impact program here at Every Infant Matters. So our ongoing projects prevent hunger and its serious consequences. Our flagship program is that of dispensing vitamin A to all children up to the age of 5 years to prevent blindness. Then we have a holistic health program in which we deworm the children. We promote the good practices of childcare like breastfeeding, immunization. We promote hygiene and hand washing, and we dispel harmful myths. And this is a very big problem in the Indian society. That is, a lot of the mothers believe in these myths which have been inculcated through generations to come. For instance, they'll stop feeding the child if the child gets diarrhea. They believe that immunization is actually detrimental to the child's health. They take children to quacks and witch doctors. I've seen children in the OPD who have been burnt with metallic rods to ward away evil spirits who would ward away ultimately the disease. These are the kind of practices which are actually very, very bad for the children, but are being followed extensively amongst the Indian population. Last year we started another program where we are distributing prenatal vitamins to pregnant women to improve their nutritional status, to decrease maternal and infant mortality, and most importantly, to reduce the incidence of low birth weight babies. Low birth weight in itself is a very serious issue, with almost 40 million children being born every year with a birth weight of less than 2.5 kg, which has both long-term and short-term consequences. The short-term ones being infant mortality, all kinds of infections, sepsis, and the long-term ones being obesity, metabolic diseases, etc. And we're promoting nutrition at low cost. We are promoting gender equality. We are preventing stigma and discrimination to those with tuberculosis, HIV, or blindness. And of course, within the last 2-3 months, we've started off with our COVID-19 relief programs on a very serious scale. So what we do here at Every Infant Matters is that we work in slums, in villages, in orphanages. We work with children of construction site workers. We conduct camps in the disadvantaged areas. We serve homeless children, and we work through our partnerships to charitable clinics and other NGOs, etc. So far, we've given vitamin A to prevent blindness in 25,000 children, both in India and Africa. We've given 15,000 children deworming tablets. We've given 27,000 pregnant women prenatal vitamins. And we've done holistic health education for 32,000 disadvantaged families and educated them to promote gender equality and reduce stigma. So for the next upcoming 1 year, our goal is to develop a technology aspect for our organization and our work. And in the next 5 years, we would like to replicate in 3 more countries. We would like to build financial stability and, of course, add a lot of other projects which I have in mind. So the new projects that I'm talking about are basically related to safe water, distribution of nutritional supplements like protein bars and biscuits, and ready-to-use therapeutic foods to prevent malnutrition. Then we want to work with victims of sexual abuse, children who have undergone sexual abuse. We want to improve their mental health. We want to screen them for mental health issues and then refer them to the appropriate treatment plans. We want to start a pan-India organ donation drive and then take it to Africa as well. We want to work in the disability sector, where we want to do screening of parents of disabled children for mental health problems, because this is a grossly neglected area. And we want to help these parents cope with the disability that their child has. And we want to promote and advocate children's rights. So, but our priority right now is we want to develop a technology aspect which would be used for patient education, for screening for childhood diseases. We have in IMNCI, that is the Indian Academy of Pediatrics, they've started this program where we can screen children using 10 danger signs like dehydration, seizures, pustules over the body, rashes, etc. So we want to screen children using a technology app. We want to do patient retrieval because vitamin A has to be repeated after 6 months ideally. So we want to start patient retrieval using a technology app to send text message reminders to the children who already got vitamin A once. We can use technology to track movements of healthcare workers. We can use it for data storage and inventory and evaluations, then to analyze results and outcomes. So the One Young World has calculated a very high social return on investment for us. For every dollar invested in every infant matters, our return worth is 71 USD. And no child should go hungry. That's what we are aiming at. And no child should have to go without healthcare interventions like immunization. And with your support, hopefully the fight will go on. That's what we've been doing in Every Infant Matters, but I would also like to talk about our work in COVID-19 relief, which we've started over the last 3 months. So we started off by providing protective gear in the form of face shields, personal protective equipment, hand sanitizers, protective goggles for safe deliveries to both government and private hospitals in New Delhi and in Assam. And who we are targeting the low-paid hospital staff, such as the guards, the nursing orderlies, the housekeeping staff, the kitchen staff. We are targeting these people because they cannot afford to buy this personal protective equipment on their own. And they are at as much risk as the doctors for infection. And if one of them get it, it's going to spread badly within the hospital, because we all know that's what the nature of COVID-19 is. So these are some of the pictures of the COVID-19 relief efforts which we've been carrying out. We've been distributing hand sanitizers. We've distributed almost 600 hand sanitizers to 600 families. Then 120 bottles of hand wash we've distributed in disadvantaged communities. And so after the Great Indian Lockdown happened around a month and a half ago, we realized that migrant workers and daily wagers are the worst affected, and they're not getting food to eat. They are homeless, they are jobless, and they are hungry. So we started off with a distribution drive for these people, where we are distributing grocery kits of 20 kgs of rice, flour, pulses, 4 kgs of pulses, oil, spices, and salt. We made a kit of such provisions, and we've distributed them to almost 300 families as of now, and we're doing around 100 more. Again, these are the pictures of our distribution drives. And we also distributed hand sanitizers and face shields and helmets to police personnel on the beat. This is a project we did very recently to almost 200 police personnel in Delhi and Uttar Pradesh, 2 states of India. So this is what our journey has been at Every Infant Matters so far, and hopefully we'll be able to effectively catalyze change using partnerships and the help of lovely people here at Catalyst 2030. Thank you so much.
So with this, we come to the end of our presentations. And I was hoping that people will have some comments, or maybe everyone could introduce themselves. I already know Chris and Carol. Carol, good to meet you here. Lovely to meet you, Chris. It's absolutely wonderful. So if you have any questions, we would be very happy to answer the questions. And if others would like to send some comments on the chat, or if they would like to speak up, they're very welcome to do so.
Karen is trying to say something.
Carol, you are mute. Now, how do we unmute Carol?
How do I unmute? Oh, unmute.
Yeah.
Oh, damn it. I've usually done this well. Ah,
Carol, I can't see you now somehow.
I know. I was so pleased to get it up. I'll try again. Here I am. Can you hear me?
Okay.
No.
Yes, yes, we can hear you very well.
Can you hear me? Can you hear me?
Yes, we can hear you. I can't see you somehow. Where's the video disappeared?
I'm there. Can you hear me?
Yes, yes, we can hear you very well. Yes.
Okay. All I was going to say is that this is so invaluable. This is so invaluable. As I say, I'm Carol Stone, lucky enough to be a patron of the Operation Asher here in the UK, because I was lucky enough to meet Shelley. I think it was at One Young World, wasn't it? A couple of years ago.
Yes.
What are you actually doing with One Young World? Have you got a partnership with them now?
So Radhika is an ambassador for the One Young World. Radhika, you can talk a bit about your...
Hi. Hi, Carol.
Hello.
Nice
Hello
to meet you again. Hi.
Good.
So, I'm an ambassador at the One Young World. I had spoken at Hague. That was 2018.
Oh, yes, I heard you. Yes, that's right. Well done. Yes.
Yeah. So I was.
That's very good.
Yes, that's how my association with One Young World started off. And recently we've been featured in their impact report of this year, and they're the ones who've calculated our SROI as 1:71. And I'm a pretty active member of the One Young World community. Like we've organized a few activities here in India with One Young World. We had a vitamin A and albendazole distribution camp in Mumbai with the other ambassadors of One Young World. And of late, we've been involved with Lead 2030, the scholarship program. And as well as I was nominated as one of the coordinating ambassadors for Asia One. So fingers crossed, I hope I get it. Yeah. So that's been my journey. Pretty close to the One Young World community. It's very close to my heart. I'm a very big fan of One Young World. Yeah.
And as you know, Alan Gemmell, who is soon to be coming out to Mumbai as the South Asia representative for the Foreign Office, and I think he'd like to be involved. We've met him with Shelley and yourself, haven't we, Alan Gemmell? Do you remember Alan Gemmell? Yes.
I remember meeting Alan at your place, and I think he's very active in India and even in other Commonwealth countries. Am I right, Karen?
Yes, he was the Yes, he was the British Council Director in India, but now he's sort of moved up one to become a sort of a number 2 down from a permanent secretary, I see, for the Foreign Office.
So Indians of my generation all know the British Council.
And we're also hoping to work with Tembi, aren't we, the High Commissioner of South Africa, Tembi Tambo, to set up an NGO in South Africa. Good. Okay,
yes. Yes. You know, if the lockdown comes to an end, we'll be able to meet and meet up with everybody much more often. When is Alan coming to India?
Well, he was going to come on the 1st of May, but because of the this virus, I don't think he will.
I don't think
I'll check with him, actually. I'll check with him. Remind me. Thank you.
You know, that'll be a very good partnership.
Yes,
if we can partner with Miss Tembi and with Alan.
Yes.
And, you know, and both the organizations, Every Infant Matters and Operation Asher, we can meet up with the people you are introducing us to.
Excellent.
And I think it'll be great because this platform, Catalyst 2030, is a very brilliant platform for connecting and meeting people.
Who have we got online from Catalyst 2030? Are the people online now?
Yes, there are other people online.
Yeah,
there is Chris McRae. Chris, why don't you introduce yourself? Have I muted him? Okay.
Can you hear me?
Chris.
Yes, yes.
I want to introduce Chris to everybody. Very good friend.
I met Shelley when she was doing a TEDx at the World Bank with Jim Kim. So Jim Kim and Shelley Batra, and I've actually put the video of that in the chat space. I don't know if you can see the chat space, but anyhow, I think she's one of the very few people who does really scaled work in the villages and, you know, last mile health work. And the big news is 2 weeks ago, Jim Kim left this investment bank and has gone back to Boston to try and fix Boston with the virus. So he's back fully on health work now, because for 14 months he hasn't done anything in health publicly. But I'm trying to work out, you know, we have all these urgent things like the 75th anniversary of the UN, the COP26, and it looks as if they're all going to get cancelled. Meanwhile, you people are doing really real work you know, in really difficult villages and across India. But how do we share this? I mean, is there going to be a plan B for the UNGA in September where it's all done on Zoom? And if so, can we make sure you're the first talk given at the UN on Zoom? Or how do we make sure that the people who are doing the real stuff on the ground get connected while everyone is only online?
Yes, I think that's a very interesting point, Chris, and I would love to have a further discussion on that, and maybe you, Carol, and other people could contribute your thoughts, because it's very
well, we can't
important.
do what we just have to do what we can, Chris, with what we've got. I mean, we can't meet up at the moment because we can't travel or anything. It is a shame. I hope the lockdowns will get lifted soon. Boris, our Prime Minister, is going to speak this evening, but I don't think he will lift them yet. But I'm sure we can do things without that, because Zoom is such a sensational, and Skype, particularly Zoom, such a good way of bringing. I've just listened to a concert with 100 people for Zoom. You know, I think we will better do things. Get groups together to come and join us.
Yes, what
I
think is important is to have some kind of forward diary, so that, you know, as far as I can see, for example, the United Nations has not yet released any views on what is going to happen in September. But I mean, if no one is coming to New York in September, can we at least start to plan and make sure that really important presentations like Shelley's, are in the front of the catalogue?
Well, we should talk to people like Baroness Verma, who is from India and who is the head of the women for United Nations here in the UK. So I don't know if you've met her yet, Shelley, but we should do something like that and get her involved too. It's a good idea, Chris. Thank you.
Okay, thank you.
Thank you, Chris. Thank you, Carol. I think these are brilliant ideas. But ultimately, it's all about the voices of the people, reaching the right people, the policymakers, and the guys at high level. So I think both Radhika and I would be delighted to participate in any kind of, anything we can share with you. We can prepare presentations, make presentations.
Well, I've made a note of those three names to see if we can get Alan Temby and Baroness Verma involved. That would be wonderful.
I have one other question, which is, could you send us just a very short description, Shelley, of what it is like in India right at this moment due to the virus? In America, we get no coverage of India whatsoever. You know, I can put on all the cable TV and there's never any news of what is happening with COVID in India. So if you could just send us a very short update of, it would help, because then I could pass it around.
Yeah. And also on the online, it only often mentions Cambodia and India. It doesn't mention these other countries you've been talking about today. It would be nice if that could be just a bit, broadened out so that we know exactly what countries we're in now.
Right, because there are many things. One is the numbers, one is statistics, and the other is how people are coping in this terrible crisis. It's a terrible pandemic. And the fear in everyone's heart that the next pandemic is going to be poverty and hunger as a consequence of COVID. So there are many things that come to mind. It's not merely the lockdown and the virus and people dying. What will happen next? What is going to happen in the aftermath of the virus?
I agree with that, but I have never been more aware of the haves and the have-nots, which you are already aware of. Bangladesh, in India, it's heartbreaking. But even here, people who are pushing their prams around, mothers with 3 kiddies that haven't even got a balcony, and other people who are going to their 3rd stately home almost. So I think we've got to do something, as you say, to help the people who are mentally illness is on the increase, of course, since this lockdown. But there's so much we can do. But India is seeing those people trying to get back from Bangladesh, it is absolutely heartbreaking.
So what we need is, one paragraph on the health side, but one paragraph on your concerns. Like, I can well imagine that the whole food chain, prices may go up 2-fold for basic food. So it could be in India that more people, die of starvation than of the virus. But I mean, just a short list of how things are interconnected from the Indian point of view, because it just does not get discussed. at least the part of the West that I live in.
So that
Where
these are
do you
very
live then, Chris? Where does Chris live? Where do you live,
I
Chris?
live in Washington, D.C., which doesn't discuss anything under Trump of this sort whatsoever. For 4 years now, we're not allowed to discuss SDGs in any of the think tanks. It's crazy. They've all gone, you know, into a mode which is very much, you know, America's withdrawing into a continent of its own self, and it's really very, very hard to find who's connecting with the really deepest problems in India and things. I mean, you know, things which are, you know, sound as if they might be good may still be discussed, but the real work on the ground in the villages has been almost censored out of existence, at least anywhere that you know, when Jim Kim was around and it was the Obama area, you could discuss these things freely. Now, if you start to try and discuss them at any of the think tanks, you get booed off the floor.
Do you think Trump will get back in?
Well, that's the problem. He is massaging all the data so that he will get back in. One of the things that concerns me is that John Hopkins numbers are crazy. They are probably 40 times underreported in terms of how many people have actually been infected. Because this virus is very peculiar. Far more people under 40 get it but have no symptoms, don't get counted. But then they can transmit it to other people. But it's very confusing because, you know, what happens is Trump is on the television for 90 minutes every day for the last 6 weeks. And he just distributes any information which makes his case that he's doing brilliantly. He's not. We don't have the right kind of testing. We've been behind in every way. So it's crazy. But we need to know where are the good examples. Like maybe Korea is a good example. I don't know. Sweden's a good example. But then when you get to a really, really poor country, which country is doing something well? I don't know.
So we will be very happy to send a little page about India. What is the challenge with COVID? The medical aspect, the numbers, the personal and the emotional challenges, the logistic challenges that people are facing, and what the country is doing. Somehow India's numbers are less than the rest of the world. At the same time, we have the same issues of underreporting and undertesting as the rest of the world. Another issue is that 80% of the patients of COVID have no symptoms. So 80% people they don't even know. They are not even tested. So if we talk of 1,000 patients, maybe they are, you know, 80 times more, not just 1,000 patients. I mean, and the problem is becoming so complicated because very soon, with the numbers going up like this, our hospitals do not have the infrastructure anymore. I mean, today some doctors were saying they are from the public hospitals, which have been converted into COVID hospitals. We can no longer take in COVID patients, except those that are critically sick. So COVID patients are told to go home, nurse themselves, stay at home, and manage on their own. When you need a ventilator, you come to the hospital. So this is going from bad to worse. And you know, families like mine, I'm a physician, my husband's a physician. Radhika is working in a very, very busy public hospital dealing with really the poorest of the poor. And their children with pneumonitis. And 3 of us are so frightened that we will exchange viruses. We come home, we live in separate rooms. Before you enter, you wash your hands at the door, you take off the protective equipment, and there's a whole process for it. Go for a hot shower, and come back, sanitize your phone, sanitize your pen, your bag, your glasses, then you enter the house. So it's a very, very complicated life people are leading these days.
Can I ask you, are you able to do an antibody test on yourself to find out if you've already had the virus?
So there are many tests that are in the pipeline.
Yes.
And we are waiting for better diagnostics to come up. And I think that will be there very soon. But more than the test, the point is we need a vaccine.
Yeah,
An
but
immediate need is a vaccine.
the reason I ask is, just like you used to tell me that the best last mile health servants of tuberculosis are the people who've already had it,
The BCG
probably
vaccine.
the best people to help massively in India are those who've already had the disease but with no symptoms.
Yes.
It's not certain that the antibodies last for a long time, but
Yes.
probably for 6 months, you can go anywhere and not infect people from yourself. You can still infect them if you know, move the virus because it's on your gloves or something, but you yourself can't infect people if you've already had the virus.
Okay.
And most young people probably, you know, a large number of young people will have already had the virus.
Had the virus and not known about it. So
Yes.
what people are doing in India, some hospitals have extracted the plasma from patients who've recovered, who've got protective antibodies in the plasma, and given a plasma infusion to sick patients with COVID. Now, this is still in the experimental stage. There have been instances where patients have recovered, but for any medical intervention to be proven to be accepted, there have to be more trials and more patients. So we can't say we did it in 5 patients, so this is an accepted mode of therapy. The second point you made was a very valid point, that if you've had one COVID infection, you are sort of protected. The challenge is that the virus is mutating. Radhika, can you talk a bit about the virus mutating?
Hi.
Yes.
So one of the biggest challenges for finding the vaccine have also been all these mutations which the virus has undergone and is continuously undergoing, which is why they've not been able to, you know, earmark that strain which we can prevent a vaccine against. And aside from that, I think because of the virus being of such a new, it's a new thing, like it's called nCoV, a new vaccine, a new virus. So we don't really know much about the immunity that one infection would confer. But from what I've read about the cases in Wuhan, they are getting reactivated and are testing positive again after being latent for about a month or so. So it's you really can't say much about what's.
I mean, there's no guarantee. If you've had COVID once, there's no guarantee you're not going to have it ever again, because the virus changes its form, the proteins change, the appearance changes, and then even if you make a vaccine, that vaccine might not be effective against the whole spectrum, the entire spectrum of viruses. So these are the challenges the world is facing. But even then, hope is there. We are all here together, and I'm sure we will find a solution. And I think the kind of consortia we are forming now, especially with Catalyst 2030, you know, these are I would say the best people from across the world. They are donors, they are thinkers, they are policymakers. There's the British nobility. They have joined hands in the fight. In the fight against disease and poverty. And most important, they're social entrepreneurs. So when everyone's input will be there and we all work towards a common goal, let us achieve the SDGs. I think we might be able to find some common ground and reach somewhere. Because I read a UN report recently that said that the SDGs will not be achieved before 50 years. And that was shocking indeed. That it's going to take us 50 years to achieve what we had planned to achieve very soon because of the COVID crisis. So everything is going to be delayed. That is one of the biggest challenges I feel we are facing.
I think it's actually that people like you and the people you inspire who will do the SDGs, because you're on the ground and you're doing real things. So we need to connect you with all the on-the-ground solutions, and we need to sort of applaud your bravery for continuing to do this in the communities, because it's very hard and dangerous work, but no one else is really going to be doing it apart from the health workers.
Yes, health workers are greatly at risk. Even in the US and in UK, so many health workers have died. It's a shame. And in India,
UK.
another problem,
Yeah.
beg your pardon?
And in the UK too.
In the UK, yes. Another challenge in India is the stigma with COVID. Health workers are being chased out of homes. Nurses forced to leave their rented accommodation. Doctors going to do screening in communities wearing the full coveralls, and people are throwing stones at them. It's a shame how much irrational fears are there in people's minds. So we are not just fighting disease. We are fighting mindsets of the people. We are trying to bring around a behavioral change. And it is very, very challenging. But you know, with your support, with partnerships, I mean, Carol has been such a pillar of strength. Carol established Operation Asha in the UK as a charity and has developed a board of directors. And Carol is the co-patron now. And Chris, you've been a long-standing supporter and a long-standing friend. So I'm sure there's so many people on board.
And Inga Beale was on a Zoom recently. She was very, very good. One of our trustees, isn't she? Inga Beale from Lloyd's. You know Inga? Inga Beale. Inga Beale.
Oh, yes.
She was excellent on one of the Zooms recently. I felt very proud that she was with us. I said, I'm so pleased you're on board. Yeah.
Yes, Carol has got the most wonderful board for us in the UK, and I'm proud, I'm honored to be and privileged to be working with our US board and the UK board. So the US board has been with us since 2005. We're incorporated in the US as a 501c3, and the chairman of the UK board was previously on the US board and still is, by the way. And he's now teaching at Oxford, Duncan Stein.
Oh, yes. But picking up on Chris's point, I mean, what is the government doing and what are the journalists doing? We hear and the journalists are saying we're being treated like children. We're not being given the full facts by the government. They're doing as best they can, but they should bring us in too. Do you feel you're involved in what the governments are thinking in India? And the other journalists question it? Are the journalists questioning what's happening?
So the journalists in India are not going to allow the government to get away with anything. They are quite... if I may use a politically incorrect word, they're quite aggressive.
Yeah.
And they go after the government hammer and tongs if they don't agree with the policies and if they don't get the right data.
Good.
So I think we can rest assured that whatever information is coming out seems to be quite okay.
Good. Yeah, well, that's very good. So so how many are on this link up? How many of us are there today now? How many people are taking part now in our online?
I think there were 20 or 25 who registered. Yeah. And there's a group of 6 people on one computer. And in India, people have formed groups to attend.
Good. Anybody else we can hear from? We haven't heard from yet.
No, there are just 2 of us, me and Radhika.
Yeah, Radhika, but I meant, can other people speak from their hubs?
Yeah, of course. Natalie. And
Natalie, can we hear you, Shubham?
Natalie
and Shubham, can you say something? I'll unmute Shubham.
Maybe it's muted from this
Sorry.
side.
Shubham, you'll have to unmute yourself and speak. Natalie?
I don't know. Am I audible now?
Yeah, you're audible
Yes,
now.
yes, audible now.
Yeah, hello everyone.
Hello.
Yeah, so I just wanted to add to Shelley's words. So here in India, we have around lakhs of people who are in isolation. And as per our government records and as per our Prime Minister Narendra Modi, so he himself told that we have facilitation of around 1 lakh beds for patient. So apart from that, we have no idea how much in case the patient increases. So how will they be taken care of? And apart from that, we have around total population of around 130 crore people here in India. And with the cases wherein people do not have any symptoms and they are also being tested corona. So it's very difficult for a country like India to manage these things.
Absolutely, Shubham, you've got it right. You know, we are thinking of huge numbers, 1.3 billion people. How many are infected? How many are suffering? How many will deteriorate? Nobody knows. And
what does our last speaker, is he in the medical profession or what? The gentleman that just spoke.
Shubham, please introduce yourself, who you are.
So I'm a chartered accountant by profession and we are catering to NGOs in India.
Uh-huh.
Okay.
Apart from that, so chartered accountant is a profession in India who is basically related to finance and all.
Lovely. Thank you. Thank you
Yeah,
very much.
so earlier I was working with Grant Thornton
Mhm.
in the development sector, wherein we were involved with many international donors and donors in Australia and UK.
Oh, thank you. Thank you very much.
Thank you.
Yeah.
Natalie, please introduce yourself. Please unmute yourself and say a few words.
Hi, hello. My name is Natalie. I'm a master's student from Germany. And I was interested in this talk because I'll be studying in New Delhi in January, hopefully. But I understand the situation with COVID is very, very difficult, and there's been large migrations, and I've been trying to follow the politics as well. So thank you so much.
Thank you.
Thank you, Natalie. Thank you for joining. Thank you, Shubham.
Thank you.
Any other questions or comments? Carol, can you tell us a bit more about the situation in England? It's very
Well,
alarming.
I think that, I mean, I personally, and I have friends, quite tough friends of mine, who say they cry quite often because how the health workers and the people that work in the nursing homes, apart from the hospitals, are going in and taking this risk, and many of them are dying. And that does seem as if it should not be allowed. And I feel we should say, unless they've got the protective clothing as they should have it, they shouldn't be allowed in. Of course, then you're letting the old people mostly left to themselves. But it is quite a dire situation. I think most people are being, as you like, good. They are staying in for their own protection because the government have told them to stay in, and they're not going out and driving around or meeting other people. Some people who have got underlying issues as well as their age are particularly being careful. But there is a growing feeling that we've got to be involved with the decisions. All the columnists are saying, like, sounds like your journalists are, we need to know the facts so that we can come along with you, not just be told. There is a bit of a feeling that we're being told what to do, but not being included. But there is a worry. Of course, there's a worry. A lot of people, and of course, up to a point, people that I know have got a second home and have either shot to it or otherwise got a bit more land to walk around. It really is the people that cannot get to a park, cannot go to school, cannot actually walk anywhere that is going to be good for the children. That is the big worry. And as I say, we haven't got the same have-nots as you have in India, but certainly there is quite a big difference from those who can cope quite well and those who are really going under, particularly people like cleaners who don't go through the books. They just come along and get their cash in hand. And many people who have employed cleaners, and you can understand it up to a point, aren't paying them. I've got 2 cleaners, one flat and one in a house, and I of course pay them both, even though they don't come. But I think a lot of people say, I may not have a job, I can't afford to pay you. So in all sorts of ways, it is breaking businesses, and I think of course, the domestic violence, Baroness Scotland was speaking about it today on television, but also the mental illness. I think to be cooped up, it is very, very difficult. And I think the 1 or 2 divorces already sort of, breaking, marriages breaking because of the strain.
Okay, so life has become it's turned upside down. The world is topsy-turvy with this virus. I remember, when you think of London, I think of London as my favorite city. And when I think of DC, I think of the cherry blossoms.
Yeah.
And now you wonder, when will you see them again?
Yeah.
And whether you live through the crisis or not. Because,
Yeah,
we are health workers and we are so much at risk. And I'm more than 60. The elderly and those with comorbidities like diabetes, they are the ones who are at the maximum risk.
Yeah.
But I think this too will pass. And we should be a little optimistic. And the most important thing here is that we are in this together. We are in this together. And that is what gives me hope. That is why when I was invited to join Catalyst 2030, I was so inspired by this whole movement. And when I think of the number of partners, the number of people we've got now, I think there must be almost 80, if not more, from across the world. So I am very hopeful we will fight this like we fought so many other things in the past. So
yeah, gosh. And now we've got our Prime Minister speaking at 5 o'clock, so I'm going to have to go in a moment to hear what Boris is going to say about lockdown, etc. But I don't want to leave you if there's anything that I can add before I go. I don't know what time you're expecting to finish this.
I
Shelley?
think it's time now. We have to
Oh,
finish
okay.
now. But I
Okay,
want
then.
to
Well,
thank every single person.
thank
Natalie,
you.
Shubham, Carol, Chris. I want to thank all of you for your wonderful insights. I want to thank Atlas 2030 for this golden opportunity.
Thank you so much. I hope you all enjoyed the discussion.
Thank you.
And we'll keep in touch
Thank
with
you
everybody.
very much indeed. It's good to see you. I hope we'll see you
in
soon.
London, hopefully.
Thank you.
so
Yep.
much.
Thank
Take
you.
care.
We'll meet up in
Take
London
care.
in these.
Bye-bye.
Bye.
Bye-bye.
Bye-bye. Bye-bye. Bye-bye. Bye-bye.